Hi everyone, Dr. Nemechek here, and I want to discuss something very serious. The health of our children is being destroyed by inflammation. It goes by many other names, but it's inflammation nonetheless, and nothing's being done about it or addressed properly. The inflammation problems that we're seeing, the chronic inflammation I talk about in the food, from the intestinal bacteria being out of balance, will disrupt your autonomic nervous system and the way you can regulate blood pressure. This is causing children to have attention deficit disorder, attention deficit hyperactivity disorder. This is what causes premenstrual syndrome. This is what causes a variety of headaches, including migraine headaches. This causes general anxiety. In a different part of the brain, the hippocampus is being destroyed. The hippocampus can't make stem cells properly. This leads to chronic depression, bipolar disorder, and possibly psychosis and schizophrenia. What's happening is the children are going in, getting medications for these conditions, which I'm not against. But there's no plan to reduce the inflammation because the brain can recover. And what's happening is the doses are higher, additional meds are added. It's becoming a mess. It's tragic. And the same inflammation, though, even though we can control all those symptoms, is what is causing type 2 diabetes and hypertension and even like colon cancer and breast cancer and lung cancer in younger and younger kids. And I say kids, to me, they're like 30, 40. We've got to focus on the inflammation for these kids because these things are preventable and these things are reversible. All right? Now, it may sound self-serving, but my protocol does a fantastic job at reversing this. All right? And you can do it without me being involved. You do it by using the right fish oil and enough of it. Olive oil every day. Balancing their intestinal tract. Getting yourself a vagus nerve stimulator if you need. And you've got to take control of this for your child because a lot of the kids are going to be like, no, I don't want to. They don't see the catastrophe that awaits them. It is just worse. It is more medicines. And it's a shorter lifespan. Okay? And I hate to sound like a heavy, but I am just heartbroken at the kids that come in here. And there is no plan. It's not like this research about this is hidden away and other doctors can't see it. It's everywhere. They need to take more responsibility, these doctors, and they don't. So the fact they don't, you parents, you have to. Fish oil, olive oil, and get that gut balanced. We've got my little cheap book you can buy for $2, electronic version, and I'll put the link down below. We'll tell you what we do, tell you what the doses are. If you want rifaximin, you could probably talk your primary into that. If you want a vagus stimulator, you look online, you can find one of those. You got to start today. All right? And we got to save these children. All right. Thanks for hearing me rant. Everybody, have a nice weekend.